All right, ladies and gentlemen, dental health is a topic that impacts each and every one of us. And today we are here to take a deep dive into the fascinating world of dentistry. I'm Lynn Alexander, your host for this special Dental Dilemmas live show. We have an exciting lineup of discussion with our own dental expert and key opinion leader ready to share his knowledge and insights on the trends, best practices, and affordable treatment options in the field of dentistry. Whether you're a seasoned professional or someone simply interested in maintaining a healthy smile, this show has something for everyone. Throughout our time together, we'll explore a wide range of topics from the importance of oral hygiene and preventive care to the latest advancements in dental technology and techniques. We have already received several questions from our loyal followers that we will be answering. We'll also have an interactive Q&A session and we encourage you to send in your questions and comments. With no further delay, let me introduce you to our very own dental expert, Dr. Kumar Vadivel, DDS, MS, MBA, FDSRCS, fondly known as Dr. V, who is a board certified periodontist and a fellow of the Royal College of Surgeons of England and Scotland. Dr. Vadivel specializes in offering periodontal, implant, and oral surgical care to his patients through our ToothHQ dental specialists located in the throughout the Dallas-Fort Worth Metroplex in Texas, USA. Dr. Vadivel is also the proud author of his upcoming book, slated to release in 2024. To know more about Dr. Vadivel, visit our website at www.mytoothhq.com. So sit back and get ready to embark on a journey into the world of dental excellence. Without further ado, let's kick off this innovative and engaging dental live show. Welcome everyone to Dental Dilemmas. It's my honor to welcome Dr. V again, and let's get started.
Thank you, Lynn. Thank you very much. And I'm so excited, guys, and I'm so glad we are kicking off this live show for this year. And we, as you guys know, many of our followers, we took a break because of COVID and with a variety of challenges that we had, and we apologize for not being able to meet your expectation. But I'm so glad we are back on track, and we are going to kick off the show with as Lynn said, we got many followers, and we appreciate you all for being the loyal followers. And thank you for submitting our questions. And we are going to make sure that we are going to answer as many questions as possible. And we again encourage you to answer or post any question that you may have, and we'll try to answer as many questions. And if you're not able to do it today, then we are going to do it the next time. And thank you again. And let's get started, Lynn.
All right. Well, we have a caller here. Says here, Doctor, I am a 55-year-old woman who is interested in getting implants. I'm not in a good financial situation, and I don't have the means to cover expenses up front. I'm solely rely on Medicaid for my health care, and I understand that most of my dental clinics in Texas are not accepting it. Could you assist me in this?
Well, that's a great question. This is not an uncommon question that we get from many of our patients, because dental implant sometime may not be considered as medical necessity, and that's why Medicare or Medicaid may not cover that. And unless you have some special medical conditions, and they are not going to cover it under a medical necessity. Um, However, having said that, we have many patients that we are able to help throughout our Metroplex clinics or in any dental office that you may be able to go to, although they may not be able to help you under your Medicare or Medicaid plan. They should still be able to assist you with possible affordable payment options they have in our office and in their offices. And in our office, you can say that, Lynn, we have multiple financial options, and you can explain to the
Yes,
callers and what we
absolutely.
do will have to offer.
We have several options for patients in our office. We have third-party financing companies that help us make it affordable to fit into a monthly budget for most of our patients. And we have a layaway plan as well. And we have, options for pretty much anybody that can come to our office. So always ask those questions when you go in.
Absolutely. So, any dental office that you go to, and I'm hoping that you will be able to find somebody if there is a medical necessity that they can help you under your Medicare or the Medicaid plan. If not, talk to them about whether they can make it affordable for you. And I'm hoping that you will be able to find someone. If not, come see us Tooth HQ. If you happen to be in the Dallas Fort Worth area, we can help you as well.
Awesome. Well, let's get on to our next caller and get their question answered. Um, we have another person that says, my teeth have deteriorated over the past 25 years due to a crack that occurred a long time ago. I am in need of assistance because I have lost all but four of my upper teeth, and those remaining are in poor condition. Also, nine of my lower teeth are weakening progressively every day. I don't have dental insurance, but I'm uncertain if it covers dental implants. What steps can I take to improve the condition of my mouth?
Great question. So again, this is not an uncommon question. Again, what you're asking us is you got some teeth, I should say several teeth that are going bad, and you got some teeth that are good. And same thing, you're going on with the upper as well as the lower teeth. And it's kind of like the question that we always say, hey, either you can die hard to save the rest of the teeth, or you might just say that just call it a day and get it done and over with, and reconstructing the whole mouth. And again, going back to the previous question the previous caller had, you may not be able to find something that is going to be covered under whether you have dental insurance or Medicare or any other coverage. And dental insurance or Medicare are not going to fully cover the dental implant options. But as far as the reconstructing your mouth, not necessarily you need to have dental implants. We can definitely help you or look into or explore the option of the dental implant if it is going to be within your budget. As Lynn said earlier, we got several options that we have offered through our bank or the layaway plans. Talk to the dental office that you go to, and they should be able to help you. And if you happen to be in the Dallas Fort Worth area, come see us and we can definitely help you as well.
Okay, so um, what I was understanding you saying was that people can find ways to get through their dental treatment, many options financially, but also just their dental health as to what they need. We can guide them in the right direction. Is that correct?
Absolutely, absolutely. So what we are talking about, we are not like focusing just on the cost, and we want to find the necessity first and make sure that what is that you're going to need. And after we find out what we need, and we are going to find something that is going to fit your budget. We are not going to give you a this is what it is and you need to do it, but we are going to find something that is absolutely medically necessity, and we are also going to find something that is going to fit your budget as well, or just any dental office and talk to them about your situation. They should be able to help you.
Absolutely. All right. So our next caller, um, hello, Dr. Vadivel. I had lost my lower wisdom tooth. I had my lower wisdom tooth removed several months ago, but I'm still experiencing severe and distressing pain, almost like electric shocks. I'm becoming increasingly worried about my condition, and it's affecting my daily life. I would greatly appreciate your help and guidance on what I should do next to alleviate the pain and discomfort.
A great question again. So what the caller is asking is, I had my one of my wisdom tooth removed, particularly the lower wisdom tooth removed. I'm still experiencing pain several months after, and again, I cannot. I really don't know the amount of time that you have been experiencing the pain, and having been doing this for like almost 3 decades, 30 plus years. I don't have lot many patients that are experiencing pain for several months after the procedure, which is not common. However, having said that, it's not uncommon for somebody to experience some kind of a discomfort. And again, I don't know the degree of pain that you are experiencing, and you may be having some medical conditions, or there is something that may be a small bone spur that may be sticking out, which is not uncommon for that to happen. I have some patient that has happened, and they were able to come back after a couple of months, and then we were able to do just a little bit of filing of the bone, and they got better. So again, if you had it removed from a surgeon, and talk to your office, the dental surgeon, and if you had it done at a dental office, and talk to your dentist, and then see whether you need to be referred to a dental specialist, and they should be able to help you. And the treatment options, as far as what are the treatment options when you go in there, or if you come to my office, the standard operating procedure would be, we will take a CAT scan or an x-ray to find out what the problem is. A lot of times it could be as simple as we are going to open up the area, kind of clean it out, and if there is anything food or anything getting caught, or maybe a small bone spur, we shave it down. Or it could be as simple as you may have some infection, we are going to give you some antibiotics. So talk to your dentist, and they should be able to help you either in their own office, or send you to a specialist's office like ours, and we should be able to help you.
Wonderful. So, sounds like it would be an easy fix for someone to just go into their office that they've had the work done in, or come to us and have us look at it and just see what's going on first. Easy fixes usually in all of those areas.
Absolutely. Matter of fact, if you happen to several of our viewers on our YouTube channel, so just YouTube one of the videos, and I actually produced a video just a couple of weeks ago, or like maybe about a few weeks ago. A patient had one of her lower wisdom tooth removed, and I actually made a video of that and how exactly we treat it. So if you happen to have like a few minutes to kill, and bedtime watching, so watch our YouTube channel, you should be able to find some answers.
Awesome. Thank you, Dr. Vadivel.
Absolutely, yeah.
All right, so let's move on to our next caller. And this one is an interesting question, it looks like. Uh, Full prong implants. Does that mean dentures? It sounds to me like this person is asking about dental implants and dentures possibly at the same time. Does that sound like what they might be asking, Dr. Vadville?
Absolutely. People call them prongs, and then I just saw three patients back to back this morning, and we were talking to them about dental implants. And I'm sorry, guys. This is what it's going to look like, and it is going to be like a screw that we put in the mouth, and unfortunately, it looks like a screw. And I kid with my patients, hey, it's not like a screw that you're going to get from Home Depot that I'm going to stick it in your mouth. I kid with my patients all the time. And these are FDA regulated medical devices that we insert on our patients. And when this patient is talking about a full prong implants, and all I could assume is whenever you are going to have a complete set of teeth are completely ruined, either the top or the bottom or both, then your dentist may be recommending something like this instead of getting a regular denture like this, which does not have any hold to or secure the denture. They may be recommending something like this. We are going to snap the teeth in. We call it as either a snap-on teeth, or if you're interested in getting a completely fixed teeth, then we can put anywhere between 4 to 6 or maybe up to 8 implants, and we can give you like a complete set of teeth. So that is what I think you are referring to as a full prong implant. So definitely talk to your dentist, and they should be explained to you. And again, speaking of the options, and you may have multiple options. Either you may have a removable snap-on teeth, or you may have a completely fixed teeth, depending on what your budget is, and they should be able to help you. And if you happen to be again in the Dallas-Fort Worth area, come see us at ToothHQ. We can definitely help you.
Wonderful. So, um, for callers, just to reiterate, Dr. Vadiville, is you're saying that we have a range of implants, which what people call prongs or screws that go in, and we can do a single one. We can do some for multiples where we can restore an entire mouth with dentures that are attached to it, and different degrees of cost as well comes with that. I'm assuming.
Different degrees of cost as well as the different degrees of necessity as
Right.
well.
Okay.
Perfect. Yeah.
Wonderful. So that actually leads to our next caller's question, which is why are implants so expensive in the USA?
Um, Great question. Great question. So the question is, why are the implants so expensive, right? And this is one of the most common questions that we get asked from many of our patients. Although we make it day in and every day, this is what this young lady does, and she's my office manager. She does it day in and day out to make it affordable, to stay within their budget, despite saying that patients still think that it is expensive for them. Unfortunately, not all the medical plans or not all the dental plans are going to cover the entire cost of the procedure. And we say in our dental office, the dental benefits are going to be like a minuscule of the dental implant benefit that you may have. That's why it may end up looking like it is going to be so expensive. So again, we reiterate to our patient, hey, you're not paying for the little screw. Going back to the earlier question, many patients think, are you kidding me? This little screw costs like $2,000, $3,000, and sometime up to $25,000, $30,000 even, right? So what you're paying for is the lifetime of benefit that you're going to receive, not the procedure alone. Think of that. Once we put in the implant, let's say you are a 30-year-old or a 40-year-old, and you're going to be, seeing me for the rest of your life. I kid with my patient, we are going to be friends for a lifetime. We bump fist here, and so when you are going to see us for the rest of your life, and we are responsible for the regulatory compliance and your follow-up care, and make sure that the implants are staying healthy. So you're paying for a variety of factors, including the expertise. And in my case, I went to school for about 20 plus years to be a dental implant surgeon. So I've been doing this for the last about 30 years. So you're paying for a variety of things. It is just not the screw that you are going to get from Home Depot. I'm just kidding, guys. So you're not paying just for the device. So that is the reason why the implants are expensive in the United States, particularly because we are all regulated. We cannot just put like a screw in your mouth and just forget about it. And we are regulated by the regulatory boards and the regulatory authorities. And again, I'm sorry it is a long answer, but that is the reason why the implants are expensive. And if you happen to be in the Dallas Fort Worth area, again, come see us and talk to your dentist, and they can definitely help you.
Thank you, Dr. Vadam, for answering that question so well. So our next our next caller has asked, um, it has been 2 decades since my last root canal procedure, but I'm currently experiencing an infection in the same treated tooth. What should I do now?
So, great question. Again, not uncommon, right? So, what the caller is asking is, I had a root canal done 2 decades ago, and my root canal is failing. What are my treatment options, right? That's exactly what the caller is asking. Speaking of my YouTube videos, we just produced a video on this just like a couple of weeks ago. A patient came in with a bombed out root canal. He had a big pus pocket in the mouth, right here on the bottom left side, and you can watch my YouTube. And we talked about the treatment options available. So again, your treatment options are anytime you have a root canal. We always say the root canals are like ticking time bombs. And if your root canal failed, the first one failed, it lasted only for 20 years. What are your odds that your second root canal is going to last, more than 20 years? Depending on your age, is retreating your root canal an option? Absolutely, yes. And if you are having recurrent infection or reinfection. And considering a dental implant is not a bad option either. All you have to do is talk to your dentist, and whether if root canal is not an option for you, they can very easily remove the tooth and reimplant the tooth with the dental implant. That is what we do all day long. Absolutely.
Wonderful. So um, that's also another way to get people to look differently at their health is looking at the options for
Abs-
everything that they do.
Absolutely. So the key is to treat the infection. You don't want to have any infection in the mouth, and you don't want this to get into your body. So either redo the root canal treatment or talk to your dentist about treating that with a dental implant. Those are the best options for you.
Awesome. So it looks like we have a Spanish speaking patient interested in implants, it looks like. So, necesito implantes. I need implants for my missing teeth. Can you please provide more information about the options available and the costs associated with them?
Great question. Necesito implantes, right? So you do need a dental implant. Um, I would like to know more about the necessity for the dental implant. So we don't stick implants in there unless we see the necessity for it. And I would like to know more about, or you, any dentist would like to know more about whether you need one implant or you need multiple implant before you need the implants, whether you have enough bone to place the implant, and that depends on how long you've been missing these teeth and whether the extraction was done properly and in a very non-invasive manner. So anytime you go to a dentist or a dental implant specialist like me or anybody else, the first thing that they are going to do is what we call it as a CAT scan. Once we do the CAT scan, then they should be able to evaluate your dental condition, and in addition they are going to evaluate your medical condition, and then they are going to evaluate the medical necessity for you, whether you need a one implant or two implant or you are going to need multiple implant. After they evaluate all your options, and they're also going to put a plan together for you. And as we talked about earlier, we are not going to throw in and tell you this is what you're going to need. Also, we are going to find a way that we are going to fit this into your budget and come up with a plan for this is what you need, these are your options, and this is your budget. Then we can find the best treatment for you. And wherever you are, whichever part of the country that you are in, talk to your dentist and they should be able to help you. And again, if you are in the Dallas Fort Worth area, come see us and we can definitely help you.
So, if I'm understanding you correctly, it sounds to me like going in for a consultation is the first step. Going in for the consultation, the CT scan, and having that evaluation done because it is so hard for us to diagnose over a phone call. That we get those calls every day at work. So
Abs-
it's just getting that consultation is what I hear you saying needs to happen first.
Absolutely. I call it as a CAT scan. If you watch the movie Madagascar, that's what they're going to call it. So
Okay,
watch Madagascar. Yeah.
Okay.
CAT scan, CAT scan.
Okay.
Yeah.
All right.
Yeah.
So let's move on to our next caller. Um, how much time does it typically take for stitches from wisdom teeth to be removed, to be dissolved?
Um, so great questions. I do remember talking about the same question like when we had our live show about 3 or 4 years ago, and I have the same exact again. Guys, go to our YouTube channel. Most of those questions, like you guys are asking, some of them you're going to definitely find those on our YouTube channel. So what the caller is asking is, I had my wisdom tooth removed and I had a stitch put in, and how long is that going to take for my stitch to dissolve? That's what the caller is asking. So depending on the type of stitch, or like a suture we call it, depending on the suture that was performed at the time of the procedure, most of the time, and we do not use what we call it as a non-dissolving, the stitches that do not dissolve. Very rarely nowadays we use the non-dissolving stitches. So more than likely, what you may have a type of suture the surgeon might have used, and the one that I use in my office, depending on the procedure that I offer, they stay anywhere between a week or 10 days up to like about 4 to 6 weeks. So if you have multiple stitches and if you had the procedure done over 6 to 8 weeks ago, and it may be the small remnants of the stitches, maybe they're still sitting in there, they are not still dissolving yet. So maybe you can just wait, depending on, you can just make a simple phone call to your dental office to see whether they used a dissolving stitch. If that is the case, you can forget about it, and once you start functioning in that area, possibly start chewing, that should go away. And if not, if you continue to be concerned, you don't have to be really concerned. You can talk to them when you go back to for your regular routine cleaning, and they should be able to help you, or make a follow-up appointment. Any dentist should be able to help you to just to take care of that for you.
Great. That sounds like a good advice to just go talk to your dental office and get in if you're concerned. Any concerns that you have, you should be able to get in.
And just like you said earlier, simple fix.
Simple fix.
Simple fix, yeah.
All right.
As simple as a fist bump.
As
There we
simple
go.
as a fist bump.
Right.
Yep. All right. So our next caller, it says, "Hello, doctor. Could you tell me what leads to the development of bad breath following a tooth extraction? I researched it and found that a dry socket is one of the potential causes, but it's mentioned that bad breath from a dry socket typically only lasts for a few days. Why is it that my bad breath hasn't improved even after diligent brushing and flossing? I've been dealing with halitosis since my tooth extraction, and it has persisted for years now."
A great question. So, what the caller is asking is, she had a wisdom tooth removed and she has been having bad breath ever since, or she is thinking that she is probably like the bad breath is continuing to get worse ever since the extraction. Um, so again, I wish I could diagnose over this YouTube live show what is going on with your mouth, but in medicine we say common things are common. So common things are common. What that means is bad breath is one of the main reasons most of our patients I, complain about bad breath. Lynn, do you know the answer?
Why they complain about it?
Yeah. What
It
do you talk to them about every day?
periodontal disease.
Exactly right. So, what is periodontal disease?
It's infection in your mouth.
Infection in your mouth, infection of the gums. So, infection of the gums is one of the most common reasons why you get the bad breath or halitosis, we call it in medical term. So, I can assume that what possibly happened is you had a progressively worsening periodontal disease, which possibly caused cavities, led to cavities also that caused pain to have one of your wisdom tooth removed. However, it is just coincidental. Your bad breath would have worsened anyway. So you, at least you, I'm so glad you got out of pain and you're not in pain anymore. You got the wisdom tooth out. However, you definitely, from what you sound like, you have progressively worsening gum disease or progressively worsening multiple cavities that are going bad, and it is going to get worse, and it is going to progressively make your bad breath worse. So my recommendation is as simple as we said earlier: go talk to your dentist, and they get a CAT scan, they get or like a bunch of x-rays, and they are going to diagnose any gum disease you may have, and they're going to take care of you.
Thank you. That's more wonderful.
What do we do in our office for gum disease treatment? Tell the viewers. So what
The
do we
type
do
of
for?
treatment?
Yeah, what do we do for
Our
gum
type of
disease?
treatment that we have in our office is can range from deep gum therapy to osseous laser therapy, um, and then followed up by periodontal maintenances every 3 months so that we keep that bacteria out of your mouth.
Uh,
And then we also talk about how it affects your whole body.
yeah. Speaking of that, speaking of the um, the oral health, how it is connected. So we are going to come back to that, and this may not be a question from there, but we definitely want to share that with you. After the next question, let's talk to them about that. Yeah.
Okay,
Okay.
sounds good. All right, so our next question is, I have a dead tooth where the nerve has been removed and sealed to prevent bacterial infection. Will this tooth remain in my mouth or will it need to be replaced at some point in the future?
Sorry, repeat that question again for me.
I have
Yeah.
a dead tooth where the nerve has been removed and sealed to prevent bacterial infection. Will this tooth remain in my mouth or will it need to be replaced in some point in the future? It sounds like somebody has had a root canal and not sure if it's something that they're going to be able to keep for their whole life, is what it sounds like to me.
Absolutely. Yeah. So what the caller is asking is they have a dead tooth in the mouth, and what they're asking is, can that dead tooth remain in the mouth, or will that need to be replaced? And I apologize, a dead tooth, like it sounds like a bad word or like a dirty word. And dead tooth, what we mean by dead tooth, meaning anytime somebody needs to have a root canal treatment done, what that means is when the teeth are live, or when the way the teeth live is they have a nerve and the blood vessels all they go in the tooth. And whenever you're going to get the root canal treatment done, one of the ways that we do the root canal treatment, we remove all the nerves inside the tooth. So we call it as a dead tooth. And so that is what I think the caller is referring to, is just because you had a root canal treatment done, it doesn't mean that you cannot have the tooth in your mouth, for the rest of your life, as long as you do not have any infection. Just like we talked about the previous caller, as long as the tooth is good and you do not have any continuous infection or any problems or any pain, you can continue to have the tooth for the rest of your life. And unless it is a real necessity, when you start to have problems, you don't need to worry about replacing it at all. However, make sure that whenever your dentist possibly is recommending, you may need to have like a crown put on, like a cap put on a dead tooth, because the dead tooth, when they are like in your mouth for a long period of time, they have a tendency to start to crumble. So you don't want the tooth to break, because they lose all the blood supply and then they start to crumble. So talk to your dentist whether you need a crown to help you keep your tooth for the rest of your life. And I got many patients in my practice and they had the root canal done 30, 40, 50 years ago, and they last forever. So talk to your dentist and they should be able to help you.
Great. Okay, did we want to talk about the mouth body connection real quick as we talked
Absolutely.
about?
So this is actually a question that we want to present. And speaking of this is not actually a question, but this is something that we talk to our patients every day in our practice. And this goes back to the question, the caller that they had previously, the bad breath. And it relates to every single question. People talked about the dry socket, people talked about the halitosis or the bad breath or the infection in the mouth or the dead tooth. Everything relates to the infection. So what we have understood in the medical profession is what many people are reading on the news, and they are starting to understand now, is the infection in the mouth. As you guys know, it is not going to stop in the mouth. And this is what we talk to our patients all the time, every day. When the infection in the mouth happens, and when it is particularly severe infection that needs some kind of a treatment, it is not going to stop at the mouth. So it is going to get right into your carotid, and from there, it is going to go into your heart. From there, it is going to go into your lungs and kidneys and pancreas and all the way to the brain. Some of you guys may have heard, hey, somebody died of a tooth infection and they got some damage to the brain. And that is exactly what happens. And we talk to women, and there are some gender specific issues. Women, they have pregnancy issues, preterm, stillbirth, and men suffer from erectile dysfunction. So there are so many things that could happen, and we call gum disease as a silent killer. You don't know how it is killing your body. So whether you have infection in the mouth, whether you have periodontal disease or gum disease, talk to your dentist and they should be able to help you. Does it answer your question, Ren?
It does, but is it transferable from one person to another? Does it?
Bingo, you read my mind. This is what we talk about, like, all the time. And as you guys know, go to my website and you should be able to see that. We call it, and the previous one we talked about is a mouth body connection. This one, what Lynn is referring to, is the kissing link. Why don't you talk to them about the kissing link?
Well, I'll talk to him about it because I talk about it every day.
Yeah.
So, the kissing link is because that bacteria that's in your mouth from the periodontal disease, it, as he said, it doesn't stay in your mouth. It travels to the rest of your body through your carotid artery, but it also can be passed from you to a spouse, to a boyfriend, girlfriend, to your children through saliva, babies through breast milk. So it can pass from you to anyone else. So that's it. It is very serious, and people are starting to actually take more aware of it.
I'm going to ask you a question. I'm going
Okay.
to test you now, right?
Okay.
Okay. So I can understand when you kiss your spouse or a significant other, it is going to pass on to your spouse or the significant other. How is that going to go to my children?
Well, like I said, it can go through a mother's breast milk if they're breastfeeding, but it can
Okay.
also go to sharing spoons, forks,
Exactly.
glasses, anything like that.
That is exactly. So what we are talking about, like, so of course with the spouse and the significant other, it is going to spread through kissing or through saliva. What you may not know is, hey, my kids do it all the time. Daddy, can I taste your ice cream? Daddy, can I taste your food? Can I take it from your plate? So when you pass it on to your kids and when you share the utensils, and moms do it all the time. What do we talk
Mm-hmm.
about? Tell them.
Yeah,
Tell them
talking
it.
about when a second on a baby's pacifier before you put
Exactly.
it in their mouth to get it moist, and that can pass it on to babies as well.
Do you remember we had
We
that
did. We
lady?
had a
Yeah,
patient.
we had a patient like 3 weeks ago. So definitely. So not only, like, your body is critical, and your spouse's and your family's body is critical also. So anytime you think of all of this infection in the mouth, two things: mouth body connection, kissing link. Okay. Talk to your dentist and they can definitely help you.
All
Perfect.
right. Awesome. Thank you for that. All right. So our next question from our caller is: I had my wisdom tooth removed about 4 days ago, and I still have numbness and loss of taste sensation on the right side of my tongue. It's only on the right side, and I can feel everything else. Could this mean that my nerve was damaged during the procedure?
Great question. So what the caller is asking is, they had their wisdom tooth removed and now they are still having some numbness or loss of sensation, and or the sensation has not fully come back on their one side of the tongue, and it has been several
About 4 days, he
about
said.
4 days, right? Yeah, 4 days. So it's not uncommon for you to experience some kind of a numbness, and it could happen from as simple as when we are doing an injection in the mouth. Anytime you are going to have a wisdom tooth removed, of course, we cannot remove a tooth without giving you an injection for numbing your mouth. And it could be very simple as whenever the injection went through, and if imagine if this is your nerve, and whenever we inject it, it just went into the nerve, just straight through. Or it is very possible, and the anesthetic medication, the numbing medication that we use, and it has a lot of chemicals. So you may have a little bit of medicine that kind of cause some kind of inflammation on the nerve, which is what possibly is causing the nerve to be a little bit numb, or your tongue to be a little bit numb. If it is only 4 days, I don't think it is a matter of urgency, or like there is not anything to be concerned about. And talk to your dentist if it continues to be numb. Talk to your dentist and they should be able to help you. And there are a variety of things that we do. We give you vitamins and vitamin B12, and we give you some anti-inflammatory medication. We give you some steroids, and these are the immediate measures that you may need to take. Talk to your dentist again. They should be able to give you or talk to you about all of these options. And if it continues to be numb, again, your dentist should be able to help you, talk to you about variety of treatment options, including a possible referral to like another specialist, and to see whether something need to be looked into.
Thank you. All right. So the next caller has asked, um, does the extraction of wisdom teeth or any other tooth lead to bone loss? And are there methods to prevent such loss apart from using implants?
All right. So the extraction of the wisdom tooth or any other tooth lead to bone loss. Okay. Um, so what I, what is critical is many times what people may not understand, whether they came at the right time to have the wisdom tooth removed, right? So that is one of the challenging things, that we deal with all the time. So when you leave an impacted wisdom tooth, particularly when you're older, and like let's say you are 25 or 30 years old, and you left your wisdom tooth for a long period of time, and you have a lot of bone loss that is happening, that caused the infection, that caused or led to the cavity. Now you're going to get the wisdom tooth removed. You already have done a lot of damage by leaving this in, because the right age we recommend to have the wisdom tooth removed, like your teenagers. And when you're younger, it's easier, you heal faster, you don't have a lot of damage, you do it as a preventive measure, it's all done. When you wait longer, now you are doing damage control. So not only you're trying to get out of pain, get out of infection, now you already caused some damage, and now you are trying to prevent any further damage. So as long as your other tooth stays healthy, you should be fine. Again, if you have done serious damage by doing waiting for too long, does your other tooth need to be replaced, and do you need a dental implant? Your dentist should be able to answer this question. Again, going back to what Lynn was saying earlier, it is so critical that you go back for your 3 months or 6 months cleanings. As you go for your 3 months, 6 months cleanings, if you have particularly periodontal disease or gum disease that you're dealing with, you're going every 3 months for your cleanings. And as you go there, and the dentist should be able to periodically check your dental health, meaning the dental health of the tooth next to the wisdom tooth, and they should be able to recommend whether you need a dental implant or not.
Okay. So, we have several questions, it sounds like, about some wisdom teeth here. So, our next question is also about a wisdom tooth that was situated near a nerve, but dangerously slow. So, the dentist encouraged or encountered difficulty during the extraction procedure despite the tooth being loose. They couldn't pull it out due to the stubborn roots, and um, I the this caller experienced significant bleeding throughout the hour-long surgery. So they're wanting some guidance into what can be done for that.
So what the caller is asking is, the patient experienced some kind of a problem during a wisdom tooth procedure, because it was situated very close to the nerve, and then they had some bleeding and all of that. So what I could imagine is this is what we do all day long. Being a surgeon for over plus about 20 plus years, and this is what I do all day long. We rarely come across these kind of complication. I'm not going to say that I never came across. We do have some patient, but which is a very rare occasion for us to deal with those kind of complication. But we do help dentists, and we work with a lot of dentists, and then we do have dentists we work with a variety of expertise. And the dentists that you might have visited to, I do not know their expertise level in removing the wisdom teeth, or I do not know the condition of your wisdom tooth, that you may have had a difficult wisdom tooth. Sounds like it is, because it is situated very close to the nerve. It is absolutely possible that the dentist was having some difficulty And what we don't want to do as either your dentist or even if I'm going to be a surgeon, and we don't want to go after and yank your tooth out, like what we saw a lot of people say. We want to gently remove it, and sometimes it may take a little bit longer, and we may think that it is going to take 20 minutes, and sometimes I may take like about 50 minutes or even an hour. It's very uncommon, but it can happen because we want to be gentle. So again, going back to your question, why did it take long? Because it is a possibly a difficult procedure. And if you had the tooth completed, the dentist was able to successfully remove it, which is great. And if you had any difficulty, again, talk to your dentist. And sometimes we like small pieces, we always leave them because the damage that you're going to create by going after it to remove it is going to be a lot more than and leaving it alone. So talk to your dentist again, and they should be able to help you whether this is a tooth that needs to be removed, and if not, if so, then they should be able to guide you to go to see a specialist if necessary. If it is not something that needs to be removed, and you should definitely be able to have your dentist observe it and guide you as needed.
Thank you, Dr. V. Again, the next question from our next caller is um, experiencing persistent jaw pain and a numbing sensation in their gums after 22 months after having a molar extracted on the upper jaw. Could you please provide some guidance?
So, what the caller is asking is two things. One, they are experiencing some burning sensation, and they are experiencing also some kind of a jaw pain from an extraction. Um, we talked about earlier, anytime you have a dental extraction done, one of the most common problems you may have is some kind of an altered sensation because of the nerve damage that could be created. Doing this for the last 30 years, and I wish I could fight with the mother nature and guarantee me that, hey, give me all my patient, do not give me any type of nerve damage. I don't think I can do that. So we have to work with mother nature, what the mother nature has given us. So we cannot guarantee, as depend, no matter how much of experience you have, we cannot guarantee that there is not going to be any type of nerve damage from it. What it sounds like, and it may be a little bit of like a altered nerve sensation, which you are possibly causing, you're experiencing as a burning sensation. Either it could be related to the tooth extraction, or something could be like totally a separate, a coincidental related to your medical condition or the variety of medications that you may be taking. So talk to your dentist. That is on the burning sensation. And the second thing, again, you talked about the jaw pain. It is not uncommon for somebody to experience some kind of a jaw pain as soon as after the extraction. However, sorry. So the reason that happens, the jaw pain, is because after any type of oral surgery, it's not uncommon for them to start grinding their teeth. That translates into some kind of a jaw pain. We call it as a TMJ, temporomandibular joint pain. However, if it is lasting for a longer period of time, again, it may be coincidental that you probably had some kind of a jaw pain that you had previously, which was again the TMJ. You continue to have more jaw pain because you have a missing tooth, which is made things worse. So again, it may not be related to your extraction, but it is unfortunately it's coincidental. Your medications are causing the burning sensation. Your missing tooth is making your jaw pain worse. That's what I can think of. Again, talk to your dentist. Again, going back to simplicity, as simple as having a CAT scan done,
Mm-hmm.
the dentist should be able to help you.
Okay, wonderful. So we will stay on that consistent trail of going back to your dentist.
Bingo,
So
bingo. Yeah. Any question? Go to
go to
your
your
dentist.
dentist.
Any question?
Go to your
There
dentist.
we go.
All right, well, here's an interesting question. Is it possible for dental extractions to lead to trigeminal neuralgia?
So great question. Sounds like we are going back to the world of nerves here. I'm going to say. So you got the nerve to ask me that question, right? All right. So what the caller is asking is it possible to have a trigeminal neuralgia after a dental extraction? So again, the same answer. I wish I could guarantee every single patient comes in, oh, I can do this procedure without any complication. Unfortunately, we cannot guarantee that due to a variety of condition. It could be your dental condition, or it could be your medical condition, or it could be due to the medication that you may be taking. It could be due to the tooth, where the tooth is situated, and if it is sitting really close to the nerve, or it is sitting on the top of the nerve, and there is a very good possibility that you may have some kind of a nerve damage, and which possibly could be translated to you know a complication, which is trigeminal neuralgia, because it is the same nerve which supplies the sensation to the wisdom tooth, that causes that supplies sensation to the whole face, your side of the face, which possibly could be causing trigeminal neuralgia, which could possibly cause trigeminal neuralgia. Um, Again, whether it was caused by the extraction, I highly doubt it. Whether you could have had some type of a nerve related condition, and sometimes as simple as herpes infection of the face could cause trigeminal neuralgia, your age, and whether you had some type of subclinical infection that was going on, that got triggered by the dental extraction because of the viral infection, because as simple as an injection could trigger the virus to travel on the face, on throughout the nerve branches, that could be causing the trigeminal neuralgia. Again, go to your dentist,
Go to your
right?
dentist.
Go to your surgeon, and whoever did the extraction, they should be able to tell you whether it is a complication, or it got triggered because of the variety of the condition that we talked about, and they should be able to help you. And they may even talk to you about having some the head and neck scan done, or going to see like a neurologist or a neurosurgeon. It's not uncommon for those things to happen, and although it is a very very rare condition to happen, we cannot guarantee for that to not happen. Again, talk to your surgeon. They should be able to help you.
I've worked with a few patients in the past that had trigeminal neuralgia, and anything that was done dentally, it seemed like they already had the trigeminal neuralgia, and it always affected it. It always, we always had to be really careful. So that is when you have that, go into their doctor. Coordinating with their doctor and their dentist is very important.
Absolutely, that is very critical. Yes, ma'am.
All right, so on to our next call. Um, I'm 34 years old, and my oral surgeon informed me that there was only a 2% chance of any nerve damage occurring during wisdom tooth extractions. Furthermore, he mentioned that even if nerve damage did occur, it would likely be only a partial and temporary issue. Based on the information, I decided to proceed with the surgery, taking the calculated risk. Now I am currently on the 11th day of recovery from the wisdom teeth extraction surgery, and I still have numbness in the top of my tongue. It feels somewhat like a burnt sensation, and I'm hopeful that it will eventually subside. However, as I delve deeper into my research, it appears that nerve damage might be more common than initially indicated. Is this the case?
All right. So thank you for the long question here. So the bottom line is, what the caller is asking is, my surgeon informed me there is a 2% chance that there could be a nerve damage, but what she is saying is, like, she has been experiencing this numbness which has been lasting for like about 11 days, and she is concerned whether did I take a calculated risk or something else happened. That is what she is asking. So going back to the question, the 2% chance, could you be that the two people that could happen? If you you're going back to all the risks that we talked about, your age and the degree of damage that you have already done, the medication that you take, and your medical conditions, and how close the tooth is sitting to the nerve on the top of the nerve, and how long did it take, and all of those factors are going to decide whether you're going to be in that 2% or not. So if you have a lot of these factors, definitely that 2% makes sense to me, although it is very rare for that to happen, and it could still happen. But you are saying that you are in the 11th day. So I will not be too concerned if you are on the 11th day, because it's not uncommon for you to have some kind of a numbness after like just a couple of weeks. I have patient, we wait for like about 4 to 6 weeks before we do any type of intervention after the wisdom tooth removal. So if you are on the 11th day, I hope that you have already talked to your surgeon. They either gave you the vitamin B12 I mentioned, or some kind of a steroid, or some kind of an anti-inflammatory medication. Those are all the things that you could be doing, massaging and applying ice packs on the top of all of those things that you could be doing. And all of those things should be able to help you. But if it continues to be persistent after several weeks, let's say 6 to 8 weeks, definitely talk to your surgeon, and you can be referred to like a neurologist or a neurosurgeon, or your surgeon should be able to explain those options to you.
Thank you so much. Okay, so I think we have just enough time for one more call. Um, I have a tooth decay issue that has persisted for 4 years due to a half broken tooth. There hasn't been any pain, but I've noticed that it has turned bluish and is now black. Is this a matter of concern?
So, great question. So, what the caller is asking is the tooth decay has persisted over 4 years, and it is the tooth is starting to change color. So, what that means is the infection is getting worse and worse and worse. And we already talked about this, and then we talked about in our mouth body connection. Anytime a patient says that I do have infection, and when the patient is asking, hey doc, should I get that tooth removed, and I'm going to pose that question back to them, and I'm going to ask them, how comfortable do you feel leaving infection in your mouth? How comfortable do you feel that infection causing the spreading to the rest of the body? And how comfortable do you feel this infection being passed to your spouse or the significant other? So sounds like you have an infection that is getting worse, which is what is causing your tooth to turn color. Whether you need a root canal, whether you need an extraction and a tooth replacement, or at least get the tooth extracted, and that is something, go to your dentist,
Go to your
right? So go to
dentist,
your
yes.
dentist, talk
Go
to
to your
them,
dentist.
and they should be able to help you. Again, if you happen to be in the Dallas Fort Worth area, guys, and again, we are coming to the end of the show here. Everybody watching, if you happen to be in the Dallas Fort Worth area, we got 4 locations in the Metroplex. Come see us at ToothHQ dental specialists, and we got 4 locations. If you like the show, just share it with your family and friends, and like, share, and we would love to see you on the upcoming shows. And definitely post your questions until we see you. And again, until next time, take care, guys. Thank you so much.
Thank you. Thank you, Dr. Vadivel, for being here and answering all of these wonderful questions. Um, and we look forward to doing this again.
All right.
All right.
Take care, y'all.
Bye.
Bye.